Hello and welcome to our discussion today on cartilage forming tumors. Cartilage forming tumors. These are the tumors that emerge and come out from the cartilage of bone tissue. So, in the end of the day, they are tumors, and we have two different types of tumors: malignant tumors and benign tumors. So, all the tumors are divided into either dangerous malignant tumors or benign non-cancerous tumors. So these are cartilage cartilage forming tumors known as osteo osteo is bone, osteochondromas. So we see that this purple line here, so orange represents our bone. This is obviously the distal end of a tumor. This is right where the knee joint, this is where the knee joint, where the femur bone articulates with the tibia and with the fibula. And you see that we don't just have bone, we have bone and cartilage. So the tumor starts to bulge out. The tumor is a sessile pedun, pedunculated tumor. And when we want to treat it, we excise it and we cut it out. But the features of this tumor, this cartilage forming benign tumor of the bone tissue, is that it emerges from this purple line, not from the orange bone. This is bone, this is bone, and this is bone, and this is the epiphyseal cartilage. Epiphyseal cartilage. Where did the tumor, the bulge, come out of? Did it come out of the bone? No, it came out as an extension of the epiphyseal plate. So you see here, the tumor starts to bulge out. Then, what's the next step? The tumor bulges out and attaches to the bone, and now there is this blue cap. What is this blue cap? See, in the first step, we just had an extension. But here we have a hyaline. Hyaline means glass-like. A hyaline cartilage cap. This is a glassy cartilage cap that is now on, like a hat, on the top of our benign osteochondroma. And then we see that there is a development. Let's examine what's the next step. So after this blue cap develops, what is the next step? You see, the next step, you would have the blue cap getting even bigger. So this is our blue cap. Look at our blue cap. It's getting even bigger than before. And the tumor is even bigger and getting farther and farther away from the bone, compressing nearby nerves, causing nerve pain to the patient screaming loudly from the pain. Also, this bulge, this tumor can be compressing a blood vessel, leading to a blood clot. Sometimes this tumor compressing the nerve, causing some numbness and electrical stimulation. And then the tumor keeps on getting bigger and bigger, as we see in here. So now when we look at the x-ray, when we examine the x-ray, what do we see? We see that upon examining the x-ray, we observe that when we examine the x-ray, what do we see? We see that there is a huge tumor that is on the side, that if we want to treat this tumor, we have to excise and cut it out. And then after cutting it out properly, it will not reemerge again. If after cutting this pedunculated tumor that has this cartilage cap, after removing it, if it comes out again, that means the doctor, the surgeon, didn't do a good job to remove the entire root of this tumor. So, complete removal of the osteochondroma will ensure that it will never happen again. And rarely does an osteochondroma become an osteosarcoma, malignant cancer. It is not impossible, but rarely happens. So, you have to be um, you have to be aware that in order for us to detect that there is an osteochondroma, we have to take an x-ray. And after taking the x-ray, what are we going to see? We're going to see that there is a pedunculated, pedunculated, pedunculated sessile, sessile tumor, bone tumor. And this is a actually cartilage part of the bone, and it gets bigger. And what does it have? What does this tumor have that is so distinctive? It is this blue cap. This blue cap is what makes the tumor very distinctive. So there's a bulge. Where does the osteochondroma usually happens? It happens in the big long bones, like in the knee, and in the distal end of the femur, at the knee joint, the distal end of the femur, the distal end of the femur, in addition to the forearm, the distal end of the forearm, the distal end of the forearm. In addition to that, there are also flat bones who often exhibit also osteochondromas, and these are, the the pelvic bone, and also the scapula, the shoulder blade, the scapula. These are usually the bones that exhibit the osteochondroma, but it's a benign tumor, and with surgery, it's usually resolves very well. Rarely does it turn into osteosarcoma. Now, that one is malignant. Osteosarcoma is malignant, but osteochondroma is not. So just remember, there's a bulge that comes out initially from the cartilage of the bone, and then it gets sessile and pedunculated, and it's an outgrowth, and then it gets this blue cap, this cartilage, this glassy hairline cartilage. Thank you very much, and I'll see you in the next illustration.